Health and Human Services Secretary Kathleen Sebelius traveled to Hoboken to meet with company officials from Rite Aid to highlight the company's decision to put licensed insurance agents at approximately 2,000 of its pharmacies across the United States to help consumers understand the essentials of the Affordable Care Act. Specifically, Rite Aid indicated agents will offer free consultations to help customers compare plans on state-based insurance markets. Essentially, Americans without employer-based coverage can buy a plan in the individual market, often with the help of government subsidies, which will be provided by the Affordable Care Act. Secretary Sebelius took questions from journalists in attendance and had a lot to say about how Rite Aid is a tremendous help in this matter. Thus, the independent agents will be available at Rite Aid pharmacies for up to 12 hours per week, but may be prohibited in some states by market restrictions, such as in Rhode Island, Vermont, and Massachusetts, according to Rite Aid.
We are implementing the law, and we're thrilled to have partners like Rite Aid across the country who are going to be doing outreach to give people information they need to make great choices for themselves and their families.
Are there any predictions to how many will actually take advantage of this law?
Well, the Congressional Budget Office estimated that we would have 7 million new enrollees this year with the open enrollment period nationwide. We are using those as target numbers and looking at markets at a time. Certainly in states where there's a lot of effort and outreach, people know more than in other states where there has not been as robust an educational effort, which is what makes, I think, the kind of out of Washington, on the ground, trusted validator partnerships so very important.
How important are pharmacies in the expanding healthcare marketplace? Are they a place that people will see as a go-to resource for health services rather than just filling a prescription?
Well, I think they already have played that role in communities for decades. That a lot of people might see their doctor once a year. If they have a doctor, they may see their pharmacist once a month or once every couple of weeks. They are coming in and out of pharmacies often for critical medications that keep them healthy in the first place. You just heard Victor talk about a patient who can't fill a prescription. What happens to that patient if he or she can't fill the prescription for months and gets into worse health? They'll come through the doors of an emergency room. So we're really looking at insurance coverage, which not only can help fill that prescription, but also advice from the pharmacist, which they can follow to keep them healthy in the first place.
Speaking to some patients, there's a little bit of confusion in terms of they understand that they will be penalized if they are not enrolled in some sort of insurance. So can you just explain exactly what that means?
Well, part of the goal of the law was to have a portion of personal responsibility, recognizing that the vast majority, probably 90+% of people who are uninsured would love to have affordable coverage, but just don't have an option in their workplace, or they are self-employed, or they're a farm family, or they're in a startup, or they're now past the age of 26 and have aged off their parents' plan and they don't have a full-time job at all. For those folks, there is financial assistance available. Here in New Jersey, we estimate that about 90% of the uninsured actually are eligible for financial assistance to come into a new market, to have new choices, and those choices also include not being locked out because of a pre-existing health condition. A number of uninsured can't get into the market too often because they aren't in a big group plan and they have a pre-existing health condition. So we're looking at a new marketplace. Starting with 2015, if an individual does not voluntarily carry health coverage or have take it up with their employer or the VA system or Medicare and can afford it, they will pay a penalty as part of their taxes due in 2015. And that's really to recognize that those folks are going to get health services. If, God forbid, a motorcycle accident occurs or somebody gets in a car wreck, an ambulance will take that individual to the hospital. Taxpayers will pay that bill at the hospital. And we just think it's important that everybody participate.